Hi, my name is Melissa Stockwell, and I'm the Chief of the Division of Child and Adolescent Health at Columbia University Department of Pediatrics. And I want to talk to you today a little bit about the importance of vaccination, even in the middle of the pandemic. So we know vaccines are incredibly important. And while we are very concerned about the spread of COVID-19, we want to make sure that your children get the vaccines that they need to protect them against important vaccine preventable diseases, things like measles, chickenpox, and bacteria that can cause pneumonia, which is an infection of the lungs, or meningitis, which is inflammation of the spinal cord. Now, I know that there's been some difficulty potentially with having primary care visits during the pandemic in the last 4 to 6 weeks, but the good news is that things are opening up and primary care offices and pediatricians are really thinking about ways to be able to bring children in for these needed vaccinations, particularly younger children. They have all different protocols in place to keep you and your family safe. And so I would suggest that you call your pediatrician and find out when is the best time to be able to bring your child in. In addition, we know that vaccines save lives. In fact, that's probably one of the most important things that we do during our well child checks for children. And it's really important that even in this time of COVID-19, that we do bring children in for these needed vaccinations. Things again, like for measles or chickenpox or pneumonia or meningitis. And while we are waiting and can't wait for the day that we have a vaccine against COVID-19, what's really important is that you talk to your doctor now to make sure that your children are getting the needed vaccines. We know that these diseases can still spread. We just had a measles outbreak here in New York City last summer. And what we would hate is that in the middle of this pandemic, we increase the risk of these potentially devastating diseases spreading any further.